Next subject, which is outreach to the Spanish community, different models and solutions from two U.S. organizations. Well, we have two speakers for this. Ms. Leslie Chambers from the American Parkinson Disease Association, and Ms. Claudia Martinez, who is Outreach Coordinator from the Muhammad Ali Parkinson Center. I believe that Ms. Chambers is doing the first talk. Thank you. You're both coming up. Good.
Good morning, and thank you, everybody. I'm Leslie Chambers, and Claudia Martinez is over here, and she's going to be tag teaming with me on this presentation. Okay. So, my role is to talk a little bit about the kind of macro level about reaching out to the Spanish-speaking community in the United States. So I'm going to go through a little bit of data and some slides to kind of set the stage for the needs of this particular community. And then to talk a little bit about the programs and services that the American Parkinson Disease Association has begun. And in full disclosure, we're at the very early stages of our initiative, so we're going to talk kind of at the beginning level, and when Claudia speaks, she's going to talk about the great experience that she has had at the Muhammad Ali Center. So just a little bit about our organization. This is our vision and mission statement. I'll let you read this due to time. But the primary focus of the American Parkinson Disease Association is to provide programs and services nationally across the country for people with Parkinson's and their caregivers and the community at large, as well as investing in research. And the goals of our research are primarily to foster young scientists in the field of Parkinson's disease, as well as established researchers to help them do proof of pilot studies. We deliver our programs and services in a variety of areas. First, through our national office. We're located in Staten Island, New York, and I'd just like to see a quick show of hands of whoever has been to Staten Island, New York. Oh my gosh, that's amazing. Thank you. Wonderful. So at the national level, we develop most of our materials and programs and services, national webinars. We're finding this is a great way to reach out to communities across the country, and we're going to be investing in those programs going forward, as well as delivery of services and programs through our chapters. We have 20 chapters located throughout the United States, and the interesting feature about our chapters is they're almost primarily led by volunteers, although we're starting to target particular areas where we can have paid staff, especially in special initiatives, and we'll talk about that in our Spanish outreach program. We also deliver programs and services through our information and referral centers, and these are located in major academic or neurological movement disorder centers across the country. But this is a place where we have a trained information and referral coordinator who's in the community working with all different groups delivering information and referral services. We also provide services, and some of these overlap, at our 8 advanced centers for research. And we also have some specialized programs and services. One that has been delivering programs is at Boston University, and that's our specialized center for rehabilitation. We're also partnering with the APDA across the country to help deliver programs and services for veterans. And we also have some specialized programs and services for the young onset. So just real quickly, I'm just going to bring you through. These are the 5 components of our strategic plan, and as we were developing our plan, we realized that we had pretty much been a one-size-fits-all when it came to developing programs and services. And so in our initiatives for this year, we really wanted to look at how do we enhance our organizational capacity at the national level and local level to reach underserved communities. And so our first project was to reach out to the Spanish-speaking communities. I'm just going to take you through a couple slides just to kind of get a feeling for the population and of Hispanics and Latinos across the country. This first slide is a graph, and again, it's very, very tiny, but you can see where the darker areas are. Those are the places that we've been targeting because of the population centers. So this is based on the Pew Research study, and in summary, approximately 41% of this population is based in the West, 36% in the South, followed by 14% in the Northeast, and 9% in the Midwest. And the states that we've identified for where we think we will have the greatest success because of the most of the folks that live in these communities. 25% of this population is represented by the states of California and Texas alone. So that was kind of a no-brainer. And so it was important that we start our resources in these particular areas where most of these populations are. The next category in density of concentration are in the states of Florida and New York, followed by Illinois, Arizona, Georgia, and New Jersey. So some of the features and some of the reasons why this area is so important are in these boxes here. And basically, in summary, this population is comprised of 55.3 million individuals, which represents 17% of the United States. So once again, the data shows that this is the community that we need to be developing resources for. And some of the particular challenges in this community, many of the individuals work in professions or in agriculture where they have a higher exposure to environmental pollutants and pesticides, where we see an increased risk for Parkinson's disease, as well as the social, cultural, and political issues, such as lack of access to care, and in some cases, as was pointed out before, cultural factors preventing the ability to get good care for Parkinson's disease. And this slide, just very quickly, I'll just show you graphically, represents how this particular community, if you look at the middle bar here, the Hispanics and Latinos versus the whites in terms of access to care. The green bar shows that in 20-some indicators having to do with access to quality care, close to 14% of those indicators, individuals fared much worse than the white population. 4 was about the same, 3 was actually better, and those are access to care that was actually addressed in this time period. But the bottom line here, these green bars show that these minority populations fare less and worse to the white population. So once again, this is a priority for developing programs and services. And this last map, this is based on research that was done by Dr. Willis and Dr. Reset, who we have supported, that looked at Medicare data. And you can see the darker red colors are the area where we have a higher prevalence of Parkinson's, which makes sense. You can see in the California area, down in Texas, Florida, and New York, and the Northeast Belt. This is, again, the areas that we've identified where we need to develop programs and services based on prevalence of Parkinson's and the findings for the Hispanic and Latino population. Okay, so just quickly, I'll point out the things that we have been doing at the American Parkinson's Disease Association. Our first challenge and goal, which we've completed, was to identify and hire bilingual, bicultural staff at the national office in the field, as well as to continue to develop materials and resources. So we, first of all, looked at our educational materials, and later on today in the panel, we'll be sharing those with you. But we translated those materials into Spanish, as well as culturally appropriate materials. We also have a Spanish website page on our website, and have also created a Spanish call center. Phase 2 talks about the continuation of those things, which we hope to be bringing at the next World Parkinson's Congress. This is our staff. I just wanted to identify Rosa, who helped me here, but she's going to be leading the help me lead the session later on this afternoon. We hope you'll come visit our booth because we will be doing special presentation on Friday of this week of our materials in Spanish and some of our representatives from across the country. Dr. Castellanos, who's also helped as a volunteer, and Ricky Chavez, who we have hired as our program director in Chicago. These are some of the samples and materials that we will share, and again, they're all available on our website. We will have some of them later on today. And also wanted to draw your attention, we also created a public service announcement, which is also on our website, our future programs and services. And I'll leave you with this quote. One of the most important things you can do on this earth is to let people know they are not alone, and that applies to everybody. So thank you.